Hello everybody. Today I will discuss about the topic which is minor ailments of pregnancy. We all know in the time of pregnancy there occur a various kind of problem. Some is major and some is minor. Minor problem in pregnancy are very common. So in today's discussion we will discuss about the minor ailments which occur very commonly in the time of pregnancy. So let's start. At first, definition. What we think or what is minor ailments of pregnancy? Okay. Minor ailments of pregnancy are those disorders which may occur due to hormonal changes, accommodation changes, metabolic changes, and postural changes also. That means in the period of pregnancy there is certain hormonal changes occurs in our body, and along with this accommodation changes also occur and bodily metabolism changes also occur. So by these changes, both the hormonal changes, accommodation changes and metabolic changes and also the postural changes, body show some kind of abnormality or some kinds of deviation from the normal, which is commonly termed as minor ailments. Then we will know about the sign and symptoms and management. Sign and symptoms, that means in these minor ailments or minor disorder, what sign or what symptoms may appear, and also their management, especially home management. We all have to know about the fact of that minor ailments and also their home management, because home management and home care is very much necessary for the pregnant mother. Okay, so this portion is very important. Okay, at first, gastrointestinal system. In gastrointestinal system there is at first nausea and vomiting and morning sickness. Okay, nausea vomiting, it occurs between 4 to 6 weeks of gestation. Nausea vomiting occurs in the early pregnancy, in the first trimester. 40 weeks of gestation, in 4 to 6 weeks of gestation. Okay, so remember one thing, nausea and vomiting develop in the first period or first time of the first trimester of the pregnancy. Okay, it occurs possibly due to high levels of human chorionic gonadotropin hormone or prostaglandin, emotional factors like tension. um, in the time of pregnancy period, sometimes there many psychological factors act on this period like tension, anxiety, etc. Due to tension or any psychological impairment or psychological problem, anxiety, there may be an event occur. What is the event? Increase level of human chorionic gonadotropin hormone or prostaglandin. Okay, so by this mechanism, uh, prostaglandin or human chorionic gonadotropin hormone is increased and nausea vomiting is occur. And what is the preventive measure? Preventive measure, that means home preventive measure. Okay, at first avoid fatty spicy food. Spicy food should be avoided. Also irritative food, allergic food should be avoided. Take small and frequent meal per day, because a large amount of meal create the situation nausea. Okay, then take protein and carbohydrate rich food. Take fruit also, fresh fruit also, and avoid brushing after arising early. Sometimes it create nausea, sensitive of nausea. Okay, so these are the preventive measures of nausea, vomiting and morning sickness. Then it is heartburn and acidity. What is heartburn? Burning sensation in the mediastinal region is called heartburn. Why it is occur? This mechanism is very important. Please listen carefully. Okay, it results from relaxation of the cardiac sphincter and the decreased tone motility of smooth muscles which is due to increased prostaglandin, thereby allowing for esophageal regurgitation, decreased emptying time of the stomach. What happened? Here also the hormonal factor like progesterone act. Okay, when the progesterone level is increase, then progesterone level increase, and then relaxation of the cardiac sphincter and decreased the motility of the smooth muscles. Okay, and esophageal regurgitation occur and decreased emptying time of the stomach, and this causes the sensation in the mediastinal region. It is named as heartburn and acidity. It is very common in the pregnancy time, in the first pregnancy time, first trimester of the pregnancy. Okay, preventive measures: avoid overeating, avoid allergic food eating, not to go to bed after meal. Liquid antacid can be taken as per doctor's order as situation basis. Okay, then constipation. It is occurred due to diminished activity, gut movement is less. Constipation, when constipation occurs due to the diminished activity. What is the preventive measure? Eat green leafy vegetables and fruits, restore regular bowel habit. Then excessive salivation. It is the most common problem in the pregnancy. It is known as dialysis. Okay, preventive measures: decreased fluid intake at night, frequent mouth care should be taken. Okay, then hemorrhoids. It may cause annoying complication like bleeding or may get prolapse. What is preventive measure? Local application or ointment according to the doctor's advice. Eat fiber rich food. Okay, but for all of them surgical treatment is better. Okay, then the reproductive system, GI system is over. In the reproductive system, at first breast tenderness, it can occur from the first trimester through the third trimester. It is occur why? Due to increased level of estrogen and progesterone. Breast tenderness can occur due to the increased level of estrogen and progesterone. What is the preventive measures? Drink adequate amount of water, cotton bra should be wear, and supportive bra should be wear. Okay. Then excessive vaginal discharge. It occurs from the first through the third trimester due to the hyperplasia of the vaginal mucosa and increased mucus production. In the time of pregnancy, hyperplasia of the vaginal mucosa is occur, and the mucus production is also occur, and as a result of this condition, excessive vaginal discharge is occur in the first to third trimester of the pregnancy. What is the preventive measures? Wearing cotton underwear, clean the private area regularly. Okay. Then urinary system. In urinary system, at first frequency and urgency. Frequency and urgency is a very common problem. It is occurred due to in the first trimester of the pregnancy. Preventive measures: Kegel exercise can be done, voiding after some interval, and water should be taken in small amount but frequently. Avoid to take in large amount. Okay, water should be taken in small amount but frequently. Next, musculoskeletal system. In musculoskeletal system, at first backache. Backache means back pain. It usually occurs in the second and third trimester. Backache is very common. Okay. Physiological changes that contribute to backache are joint ligament laxity, weight gain, hyperlordosis, and anterior tilt of the pelvis. These are the conditions that are responsible to precipitate the condition of backache. What are the conditions? Joint ligament laxity, weight gain. Excessive weight gain. In pregnancy time, weight gain occur. So excessive weight gain is a precipitating factor. Hyperlordosis and anterior tilt of pelvis. What are the management? Avoid heavy lifting. Rest. Well supported sitting. Comfortable position should be taken. The mother can advised to sit in a chair, in supported chair. Okay. And mind diversional therapy can be taken, because in the cases of pain management, mind diversional therapy is necessary. Okay. Then cramps. Cramps is also a very common problem in the time of pregnancy, which usually occurs in the second and third trimester. What are the conditions that are responsible to develop cramps? It may be due to the deficiency of diffusible serum calcium and elevation of serum phosphorus. Okay, in the starting point of this topic, I told that metabolic changes take place in the time of pregnancy, and what metabolic changes are responsible to create this condition like cramps? uh, Calcium, deficiency of calcium and serum calcium, and elevation of serum phosphorus. This point is so much important. Please remember this point. Okay. Then the management. What are the management of cramps? Raise the foot end of the bed by about 25 centimeter. Foot 25 centimeter raise. Okay. Then gently leg movements frequently. Take vitamin B complex. The dose is 30 mg. Vitamin C, vitamin D rich food, calcium and magnesium rich diet. These are the management. And then the respiratory system. In respiratory system, the problem is shortness of breath. It is caused by the limited expansion of the diaphragm by the enlarged uterus. Enlarged uterus, it is a common in the development of pregnancy, and by the enlarged uterus limited expansion of the diaphragm occurred, which causes shortness of breath, and it can occur in the second and third trimester. What is the management of shortness of breath? Maintain good posture and comfortable position. Avoid overeating. Stop or decrease smoking. Frequent rest. Okay. Then nasal stiffness. It occurs during the first through the third trimester. It results from estrogen, which causes swelling of the nasal tissues. High levels or increased level of the estrogen, which causes the swelling of the nasal tissues. Management encourage the use of humidifier. Okay, according to, and some medical management can be taken according to the doctor's advice. Then in the cardiovascular system, at first fainting. It occurs because of the vasodilation under the influence of progesterone. Increase the amount of the progesterone and vasodilation is occur, and which responsible for precipitate the condition of fainting. Here you can see the picture of fainting. What is the management of fainting? Avoid long period of standing. Sit or lie down as soon as the sensation of the fainting occurs. Here you in the picture you can see the pregnant mothers can is seated or lie down by the response of the fainting. The next point is varicositis. Varicositis is more common problem. Okay, here the picture you can see the varicosites vein, varicocitosis. What is varicocitosis? Weight of the uterus partially compresses the veins that return blood from legs. By the weight of the uterus it can occur. Management: exercising the calf muscles, resting with legs elevated. You can elevate your legs in 25 centimeter. Okay. Then integumentary system. At first hyperpigmentation, it is most common problem. The only management is psychological assurance you can given to the pregnant mother. And then edema. Here you can see the picture of edema. It occurs due to the increased venous pressure, decreased osmotic pressure in the blood, increased capillary permeability. Okay. So the three conditions are responsible for developing the edema. like increased capillary permeability, decreased osmotic pressure in the blood, increased venous pressure. What are the management? Avoid long period standing, encourage active exercise, use elastic stocking. Elastic stocking is very helpful in these cases. Okay, I hope you people can understand. Then nervous system. In nervous system, it is a common syndrome like named as carpal tunnel syndrome. What is this? This is, here you can see the picture. Okay, this is the swelling, numbness, tingling or pain sensation in the hands and fingers due to fluid retention. Due to fluid retention, the swelling sensation, numbness and tingling and pain sensation occur in the fingers and hands. Causing the pressure of the median nerve. Here in the picture you can see the you can see the pressure on the median nerve. Okay, it usually occurs in the second and third trimester of pregnancy. Fluid retention leads to the compresses of peripheral nerves. What are the management? Keep the hands cool, avoid repetitive movement, support the hand if needed, and when the pain sensation is take place, rest your hand, okay, as much as you can possible. So it is over. Then insomnia. Insomnia is very common problem in the time of pregnancy. Sleep disturbances occur because of the frequency of the micturition, fetal movement. What are the management? Avoid caffeine, avoid irritating food which reduces the sleeping pattern, modified sleeping in environment. Apart from this, music therapy can be taken, because in some cases applying the music, the people can feel better. Okay, so music therapy can be given, comfortable position can be given, family assurance, support, communication can be given. Okay. Okay, I hope you people can understand about the topic minor ailments of pregnancy. What are the minor ailments and what causes this condition, and what are the preventive measures, especially home preventive measures in the cases of minor ailments of pregnancy. In pregnancy, minor ailments, it is a very common problem. It is uh, so not so much tension cases. Okay, in the cases of minor ailments, mostly preventive measures can be taken. By the use of preventive measures, we can manage this situation. Okay, I hope you people can understand about today's topic. If you have any query or any question about this topic, you can ask me you can ask me in the comment box. Okay, and in the previous class, I have discussed about two topics. In the first of this channel's video, I have discussed about care of adolescents, which is a very important topic, and the second topic I have discussed about the first portion of the regulatory bodies. It is a very important topic in the nursing management, and today I have discussed about the minor ailments of pregnancy and also their management. It is also a very important topic, so you people can follow this topic and relate this to your studies. And again I am saying, if you have any query or any doubt about this topic, please say about your problems in the comment box. Okay, and this is my first YouTube channel. You people can subscribe my channel for more and more videos which can help you. Okay, so thank you guys. Okay, goodbye.